Hi, I'm Gary Tobin, and my presentation today is on the research question, how accurate is drug error reporting in New Zealand ambulance services? The topic I chose is because of my experience as 20 years working as a paramedic in the ambulance service. It's something that doesn't really ever get highlighted. That there has quite a low profile really in ambulance operating procedures and in the protocols, and most documentation that exists in ambulance service, there is nothing about it at all. It's not even obliquely referred to, and I think a lot of that's because there's a denial culture, and I trialled it by talking to a few of my senior colleagues about drug error, and they just kind of shrugged their shoulders and said it doesn't really happen. We just do what we're trained to do in the procedures, and there is no drug error. So that really does contrast with the reality that you see when you start to look at research. And in my literature review, it was very hard to find. In fact, I couldn't find anything about drug error by paramedics and ambulance services, but there's heaps by nurses and other medical staff, both within and outside of a hospital setting. I mainly looked at within the hospital setting, and there's sort of the idea that it could be as much as 1 in 10 drug administrations has an element of error within it, and I can't see why ambulance service would be any different to that. So the way I decided to do this research, the methodology, was to have some semi-structured interviews. It's important to have interviewers who are credible, so that they can break down barriers and encourage an interview atmosphere where paramedics actually are not defensive and are able to talk freely. And some of that will involve the ethics of confidentiality and letting people know that anything that they impart isn't going to ever, could not identify them and will be treated with respect. There'll be an element probably of having to educate people on the nature of drug errors, because a lot of the denial would be people just don't really understand the full variety of the nature of drug errors. They just kind of see you give the wrong drug, that's a drug error, you give the right drug, it isn't, and it's definitely not that simple. Again, having credible interviewers that understand both the topic and also are expert at interviewing will help ensure the quality of the evidence. The reason that a qualitative approach is because there isn't anything to really work with to get quantitative data at this stage, and semi-structured interviews, I think an observational study would be better, but because ambulance practitioners mostly work in isolation, it would be quite hard to really observe what they are doing, because they do it, it's not predictable. It's not predictable when they're going to actually have to go and administer a medication. It would take a lot of observation over a long time. So whilst I think observational will give better data, I think qualitative will get the data more quickly with interviewing. So observational would be qualitative as well, but the interviewing will get information more quickly. The way that we analyse the data using a cross-case analysis, so to look at all the information as it's gathered, and this is inductive reasoning. It's looking at the information and then building patterns and theories from the ground up, so using the information to then start building something coherent that will be useful to illustrate what's really happening. And do this using coding, so code the data as we pull it out, sort of give it, put it into sets that match, and memoing being writing notes to myself about what the codes actually mean and how they interrelate, so that when it's all done, that can then be pulled together and presented in a written format with graphs, tables, etc. that help illustrate whatever information comes out of that. And there are computer programs for qualitative data analysis, and be looking to use a computer program to help that. The implications for the ambulance service, it's quite likely to highlight stuff which really has been buried because there is no reporting of it, and heighten an awareness of, I suspect what we'll probably find is we're not that dissimilar to other health services, and we may need to look at what other services have done to enhance their drug management and maybe adopt some of that. Again, I may be wrong, it may come out that there is no drug error, but I think that's unlikely. And it will be the basis for cultural, be a challenge, it will be a cultural challenge for the ambulance service to address the thing in such a way that we're not blaming the practitioners, because we suspect that from the literature review that it's quite normal, and what we actually need to find is a way to accept that there is a degree of error, and then how do we incorporate that into best practice for how we deliver our services. And because there's such a paucity of study, I would hope that this study would provide a basis for further studies, both qualitative and quantitative. Thank you.